Hello, everyone. Welcome to the spine and thorax disorders video. We're going to go ahead and get started with the screen share. We actually have a PowerPoint. It's not a very good one, but it has pictures, so it's all good. PowerPoint of the disorders. So let's go. Where are we here? Spine and thorax, here we are. Spine and thorax disorders. We'll just bring this up. All right, so the first three disorders are actually very similar. They are hyperlordosis, hyperkyphosis, and scoliosis. So all of these affect the spine by either increasing the curvature or decreasing the curvature of the spine. So hyperlordosis is an increased curvature of the lumbar spine. Hypolordosis would be a decreased curvature of the lumbar spine. There are a lot of different causes for this, and I'm not going to go through most of them because the causes for hyper are different than the causes for hypo. Basically, what's going to happen, though, is you're going to end up with pain, mostly muscular pain, headaches, because all of the muscles of the spine, all the paraspinal muscles, the erectors and things like that are going to be affected. And actually, in some cases, it can cause issues with the organs and organ systems that are affected by those spinal nerves that exit in the lumbar area. So, lots of different symptoms, lots of different causes. Massage is definitely indicated because in some cases, this is going to be a muscular imbalance, called lower crossed syndrome. Lower cross syndrome is something that we will cover more in detail in pain, gait, and range of motion when we talk about patterns of dysfunction. Either way, it's something that we can address as a massage therapist. So if that is the cause, then massage can help be part of the solution. If it's not, then the individual is going to need maybe a chiropractor or an osteopath, or they might even need a neurologist if the nerves are affected. I just want to show you a picture here. This is a hyperlordotic spine, so it's an exaggerated lumbar curve. And you do see this more with females than with males, primarily because females tend to carry more weight on the front or in the stomach and hip area, and also because of pregnancy. If a woman has had a child or has had multiple children, that additional weight on the front does have a tendency to pull the lumbar spine forward into that exaggerated lumbar curve. Also, women wear heels typically, so that lifts the whole posterior line, the buttocks and all, pushes the hips forward into an anterior tilt and exaggerates the lumbar curve. So again, this is really more significantly found more in women than men. Men tend to have the hypolordotic spine, or the flat back, where their back just kind of goes straight down to their legs and they don't really have a lumbar curve at all. And this is more typical of older men. But just for reference, here's a normal lumbar spine. So you can also have a hyper or hypolordotic curve in your cervical spine. And here's a picture of that. You see in a normal lordotic cervical spine, you have a nice little curve, right? Just like that. That's supposed to be there. In a hypolordotic cervical spine, you don't have a curve at all. See this lovely straight line? That's not supposed to be there, okay? That puts a lot more pressure on the vertebrae and on the discs in the cervical area. See how there's less space here than there is here? So you do not want a straight neck, is what I'm saying. In this case, again, the cause could be muscular or it could be structural. In other words, the neck is just like that. And then in that case, there's not a whole lot that you can do other than massage the cervical muscles and help relieve some of the tension that's going to be caused by having a straight neck. Okay. Now, hyper or hypokyphosis is an increased thoracic curve or an increased kyphotic curve, or of course a decreased kyphotic curve with the hypo. You don't see hypokyphosis a whole lot. You see more hyperkyphosis, especially in older individuals. The causes, of course, are going to be postural imbalances, people with a lot of weight on the front of their chest, like someone who is large-breasted. Osteoporosis can cause hyperkyphosis because the bone itself is not strong enough to hold the head and neck anymore. Those are the main causes. So if you see someone with hyperkyphosis, you're definitely going to be working on the pectoral muscles because they are going to be hypertonic as the whole head and neck move forward. If there's a history of osteoporosis, then of course, light massage only. Osteoporosis is porous bone, so the bones become a little more brittle, so you're not going to be doing deep work. The other issue is, of course, if the hyperkyphosis is in an elderly individual, then you have other things that you might need to take a look at in terms of contraindications. They're probably on more medications. They may not be able to lay flat because of the hyperkyphosis. You might have to put a rolled up towel underneath their neck when they're supine, that kind of thing. So you're going to have make some modifications for that type of spine. It is unlikely that you will be able to affect the hyperkyphosis with massage. So I'm just giving you some realistic expectations here. You can certainly make the person feel better, but you're not really going to help correct this at all. Okay. Scoliosis. All right, so scoliosis is a lateral S-shaped curve of the spine. So we've been dealing with excessive curves that are supposed to be there. Scoliosis is a curve that is not supposed to be there. So let me show you what that is. Okay, scoliosis is a lateral curve of the spine. Okay, so this is called the Adams test since we're looking at it. And this is what you're looking for. Okay, you're looking at the spine. A normal spine will be straight. You'll see it perfectly lined up with your vision when a person bends over. If somebody has scoliosis, the spine will be curved when they bend over. You see that? And of course, you can see this is a deformity from the scoliosis. So again, scoliosis is a lateral S-shaped curve of the spine. It can occur anywhere along the spine, the lumbar area, the thoracic area, the cervical area, or all of the above. There are two types of scoliosis. There's functional scoliosis and structural scoliosis. Most people that you see with this are going to have structural scoliosis, meaning there is a problem with the structure of the spine itself. They were born that way. It's a long-standing issue. You are not going to be able to correct it, okay? The functional type of scoliosis is when an individual overuses one half of their paraspinal muscles, and that actually pulls the spine towards that side. So in other words, the right side of your paraspinal muscles, your erector spinae, are really tight because you're overusing them. They're going to pull the whole spine to the right. I haven't seen this in a really long time. The only time that I've ever seen functional scoliosis was a woman, actually two people, a woman about 15 years ago who had a very old stick shift vehicle, and she had to grind the gears kind of every time she needed to change gears, which of course used to be a really hard thing to do. Now, gear shifting is really super easy and gentle, even in stick shift cars. I mean, most cars are automatic now, but even in the stick shift vehicles, it's like butter. So easy to shift gears. The other type of functional scoliosis I saw was very similar. It was a truck driver who was a long haul trucker, if I remember correctly. So driving 15, 20 hours, and he would sit on his, truck seat with his wallet in his back pocket. Okay. Now, if your wallet is in your back pocket, then one side of your hip is going to be raised up like this as you're seated. And what that did was it shifted his whole pelvis and shifted his whole lumbar spine to the left. And in addition to that, he had a big giant stick shift that he had to use. So he ended up with an S-shaped curve in his spine because of sitting on the wallet and then shifting regularly. But that was it. That's the only 2 times I've ever seen it. 99% of the time, it's structural. So the Adams test is the test for scoliosis screening. This actually picks out structural versus functional scoliosis too. So if they bend forward and the curve stays, it's structural. If they bend forward and the curve disappears, it's functional, because the muscles are then pulling the spine straight as they extend. Okay. Either way, massage is absolutely indicated. You're going to work on the tight muscles, and if it's a more severe curvature, you are going to have to modify how you do your work. So positioning is going to be important, making the table as comfortable as possible for someone with either mild scoliosis or severe scoliosis. Sometimes it's difficult to lay flat. And so you're going to have to just have rolled up towels or pillows in order to make them as comfortable as possible. Okay. All right, so moving on to disc disease. This is either a degenerated disc or a herniated disc. Disc disease, or even a bulging disc, this is a really generic term. Okay. So the most common areas for disc disease, whatever type it is in the cervical spine and in the lumbar spine. Doesn't happen too often in the thoracic spine. And that's really because you have the addition of the ribs. The ribs keep everything nice and stable, and it's not as mobile. So the cervical area moves all over the place, right? And you even have more mobility in the lumbar area. The thoracic area, not so much. You got a little bit of lateral flexion and a little bit of flexion and extension, but that's it. So cervical and lumbar area is where you're going to see disc disease. So there's a couple of different ones that we're going to talk about. We have the bulging disc, in which the nucleus pulposus pushes the annulus posterior and lateral. That's the most common place for it to go. And let's go over here. I showed you this image before. That's a bulge. Okay, so the nucleus pulposus went posterior and lateral, and now it's pushing on the spinal nerve root. Ouch. Okay, very common. Yes, it is very common for that particular pattern. If there is a bulging disc or a herniation or any kind of disc disease, you're going to have to be very careful with your pressure around the area where the issue is. So if the client knows, oh yeah, I have a bulging disc between L4 and L5, let's say, then watch your pressure around L4 and L5. Okay, and that goes for all of the disc disease, not just bulging disc. The last thing you want to do is make this worse, okay, by pushing too hard in that area. Disc herniation Like I said in a previous video, hernia means hole. So in a disc herniation, this says there are 3 stages. There's actually 4 or 5 stages. The stages don't really matter for you as a massage therapist, but certain stages are more likely to cause symptoms. And of course, if it's really severe, it might require surgery. So here's what happens. You get a little bit of a break or tear in the annulus. It starts to degenerate. Maybe it dries out and tears, or maybe you decided to lift something really heavy, like a heavy basket of laundry, let's say. You bent down and you picked it up real fast, and as you did so, you turned. Lifting heavy things while twisting is one great way to tear a disc, okay? First of all, you don't want to use your back to lift things. You want to use your legs. Second, when you lift and twist, you're putting a lot of pressure on the disc. A lot of clients that I've had who have had herniations of their discs have done so in lifting and twisting manner. So either way, you have degeneration, then you have something called a prolapse, which is basically a bulge. Then you have the extrusion. So that's when the nuclear material starts leaking out. And that's going to cause a lot of pain and inflammation, because your white blood cells are going to come in and go, hey, wait a minute, we don't recognize that. That's not supposed to be there, because it's not. And the white blood cells are going to call in their friends and produce a lot of inflammation and swelling in the area. And typically, if they have just done this, or if it's been within the last 48 hours, you're going to see and feel redness and heat over the area of the injury. Okay, so if they tore it kind of all at once, you're going to feel that and see it. Okay. Then you have total sequestration. Sequestration is basically when there's no nuclear material left. It's just a hollow shell of an annulus. Sometimes it heals itself, most of the time it doesn't, and eventually the disc just degenerates altogether and the vertebrae themselves start to be bone on bone, and eventually they'll fuse together. Or surgery to help fuse them together would be necessary. Okay. Okay, so if any one of these is occurring and it's compressing a nerve, basically you're going to have radiculopathy. Okay. Radiculopathy sounds like the word ridiculous, but it has nothing to do with that. It means radiating. So radiculopathy is going to be radiating pain, maybe numbness and tingling, maybe muscular weakness away from the nerve root that's affected. Okay, so if it's a nerve root in the lumbar area, it's going to affect the leg. If it's a nerve root in the cervical area, it's probably going to affect the arm. Okay. Treatment is not, massage is in there, but we can't do anything for herniated disc personally. We just can't. In fact, we need to avoid the area altogether if somebody has a herniated disc, because there's going to be active inflammation in there. And remember, we don't work on anything that is actively inflamed. So we can massage their shoulders if they have a lumbar disc herniation, but we should not be massaging over the lumbar area, okay? Not in an active herniation. Physical therapy, chiropractic, surgery, it really just depends on how severe it is. And only your client can tell you how severe it is. They most likely have had MRI imaging if they know that they have a herniated disc and they have a diagnosis. So they'll let you know. Okay. If they have a disc herniation, or if they have had a herniation, if it's in the lumbar area, it is ideal to put a rolled up towel underneath the client's hips when they are prone. This puts their hips into a little bit of flexion when they're laying prone and takes some of the pressure off of their low back. I have several clients who have had disc herniations even years ago that still need to have that roll underneath their hips when they're prone because it hurts if they have to lay flat, okay? Same thing if they have a cervical herniation. You want the neck in slight flexion. So if they're laying supine, you're going to have to put a roll underneath the neck to keep their head in a little bit of flexion, okay? That addition of the flexion takes some of that pressure off of the herniation itself and off of the exiting spinal nerve roots. That's why we do this, okay? It basically takes some pain away while they're laying there. This is a little bit of a star or highlight type of thing. If client presents with muscle weakness, intense nerve pain, or they are in so much pain that they can barely lay on the table, they are not a candidate for massage. They must be referred out immediately. If they can barely lay on the table because they're in so much pain, they need to go to the ER, okay? If they can barely lift their leg to get on the table, they need to go to the ER, okay? This is not a condition that we are going to address. That is more severe and they need to go to their doctor. They need to go to the ER, urgent care, whatever, okay? Says consult a doctor. We can't do that anymore because of HIPAA. You just have to ask your client what kind of surgery they had, how long ago it was, and that kind of thing. Okay, spinal stenosis. Spinal stenosis is a narrowing of the spinal canal. And what that means is where the spinal cord is. Okay, that's where we're narrowing. Let me show you a picture of it if I can. I'm going to go back one because we don't need to see that anymore. We'll go stenosis. Spinal stenosis. There we are. Yeah, giving me flexion equipment, which is kind of funny. Oh, that's a good one. Okay, right there. There we go. So here's spinal stenosis. I like this image because you can actually see how porous the bone is in general. So here, what has happened is the bone itself has actually grown a little bit. You have some osteophytic growth in here, and that has narrowed the spinal canal where the spinal cord resides. And because of that, it's getting pinched a bit. Now, let's go back here. Because the spinal cord is getting pinched, if someone goes into extension, they're basically going to squish that even more, and so it hurts. But if they flex a little bit, you're opening up that area, and so it's palliative. It makes it feel better. Massage is indicated in general for pain management and relaxation, but it's not really indicated for spinal stenosis. I want to make that clear. You cannot massage spinal stenosis away because it has nothing to do with the muscles whatsoever. And somebody with stenosis can live a happy and productive life, or it can be a major, major impediment. It just depends on how severe it is, okay? I have a lot of clients with spinal stenosis, and you wouldn't really know it. They had an MRI because they thought they had a herniated disc or something like that, and they found out that they have stenosis. So it can be mild, pardon me, or it can be, like I said, a huge issue. So here's an MRI of stenosis. Typically, this happens in the lumbar area, by the way, but I have seen it in the cervical area as well. So here it is. Here's just a little bit of stenosis here. Okay. And you can see where the disc actually has pushed into the spinal canal. And then there's a little bit of inflammation over here as well. But you could see where the spinal cord here is being squooshed, right? There's a lot of narrowing there. Okay, that's it for stenosis. Spondylolisthesis, it's just fun to say. So this is when a vertebrae slips out of position. Now, this doesn't happen very often. Typically, it's going to do an anterolisthesis, meaning it's going to displace anteriorly, and it's most common between L4 and L5. So let me show you. Oops. Yeah, that looks really bad, doesn't it? Yeah, that is bad. That is what I'm talking about with spondylolisthesis. It moves out of position, not where it should be. It's an issue, it's a problem. So what happens really, it's mostly an injury, okay? Hyperextension injury in young gymnasts. So, you know, they're doing things like back bends and a bone slips out of place, because when you're young, you're actually much more mobile. Trauma, sure, kind of accidents, injuries, falling, car accidents can cause this. It can occur in pregnancy with excessive weight on that lumbar spine. Obviously, the most common symptom is going to be pain. You can see why that would be painful. Sure. Tenderness, stiffness, surgery, braces, physical therapy. It says massage is indicated, but again, that's only indicated for palliative therapy, like to help reduce pain and to make them feel better, to relax them. It's not indicated for this particular issue because clearly you're not going to massage the spine and you can't put it back, okay? Use caution, make sure that you are going super light around the area that has the injury, or avoid that particular area altogether, okay? Because clearly you do not want to mess with that. Let's use some common sense here. All right, so last but not least, we actually have two of the things that are done for some of these injuries. So a fusion is when two or more vertebrae are fused, either surgically or it happens on their own. A lot of times when a disc is injured and somebody has to have surgery for that, what they do is they take the disc out and then they put little cages around the vertebrae to help fuse them together. What this does is it maintains the space of that vertebral canal there, okay, where the spinal nerves exit. Because if left alone, what might happen is the vertebrae might fuse kind of in the wrong position, and then you have constant pressure on those exiting spinal nerves, and that is bad. So they fuse them together to help maintain the space that you do have. Sometimes they fuse together on their own because you've had the issue for so long and you didn't notice that you weren't having any pain, let's say. Sometimes the vertebrae will fuse together by itself. I mean, obviously that takes years, but that can happen. So that is, the surgery is actually quite common. You're going to have a lot of clients who have had fusions of parts of their spine. When someone has had a fusion, the body does tend to compensate by making the vertebrae above and the vertebrae below the fusion more mobile. Because think about it, where the vertebrae has been fused together, there is no more movement, okay? That section of the spine is now stuck together. So in order to move, the vertebrae above and the vertebrae below tend to pick up the slack, basically. Unfortunately, that increases the risk of degeneration of those vertebrae, and the issue tends to work its way out from the fusion. Now, massage is absolutely indicated. after the surgery, right? 8 weeks post-surgery, you're only going to go very, very light over the area. You're not going to do any kind of deep work at all because you don't want to undo what the surgery was trying to do. But again, you can help the healing process, and just general palliative feel-good massage is indicated. Okay. So here's a fusion. Now these are using screws. Sometimes they're little teeny well, I say teeny cages. They're really not that tiny. They're little vertebrae cages. They go all the way around, or most of the way around anyway. So this is a surgical fusion here. See that? This is a natural fusion right there. You see? So this cervical vertebrae and this cervical vertebrae are now one cervical vertebrae. There is no disc. There's a disc here. There's a disc here. And you know that because there's a space, right? There's no disc here where there should be one. Okay, so that's a natural fusion that happened on its own. All right, so the other thing that surgeons will do is something called a laminectomy. A laminectomy is where they actually just remove the lamina. And that is done to increase the space in the spinal canal and relieve pressure on the spinal cord. Typically, a laminectomy is done for a bulging disc or a herniated disc because it's putting pressure on the spinal cord posteriorly. And since you can't take out the body of the vertebrae, they take out the lamina. Now, this is a full laminectomy. They've actually just kind of removed the whole posterior portion of the cervical vertebrae, but they don't always do that. Sometimes they just do one bit of it. Okay, just one little bit here and here, one lamina, let's say. Okay. So laminectomy is also quite common. I don't need to show you anymore. I'll stop the share for a second. I was just checking my notes. Yeah, laminectomy is quite common. You will see this too in your practice, I'm sure. I have had quite a few clients who have had fusions and laminectomy. So both. Anytime someone has a problem with a disc in their spine, it is going to be painful. So if it doesn't heal on its own, which sometimes it does, then surgery is going to be recommended. And those are the types of surgeries that occur, the fusions and the laminectomies. I do have one client who has had most of his cervical laminas removed. So he has a very large scar right down his posterior neck. So right where the ligamentum nuchae would be, there's a huge scar, and all of the posterior piece of vertebrae is missing through the entire area. So he doesn't have any spinous processes. So it is kind of, it's kind of weird to feel, of course, because you're expecting to feel spinous processes as you're coming up through the neck, but they're just not there. It's scar tissue instead. So you have to be really careful with something like that. That's rare though. Most of the time it's just one or two lamina, not the whole thing. Okay. So if you have any questions on any of the disorders, please feel free to post them in the spine and thorax discussion posts, and I will see you soon. Have a great day.